And for the last greeting, Dr. Elliott Antman is Professor of Medicine, Associated Dean at Harvard Medical School, and Senior Physician at the Brigham and Women's Hospital in Boston. He is the President of the American Heart Association. It is under the leadership of Dr. Antman that we have established formal cooperation with the American Heart Association, and for the first time we are going to have together an exciting joint session in Israel. Dr. Antman was here last year and provided a Neufeld lecture, and we thank you for finding the time in your busy schedule to come again. It is a real honor for me to invite Dr. Antman to address the audience on behalf of the American Heart Association.
Thank you very much, Dr. Rosenman, Dr. Segev, Dr. Bolentin. Greetings to everyone. It is such a distinct honor and pleasure for me to be back here. I will be brief, but I will build on the theme that Professor Rosenman had mentioned earlier, which is that there has been success, notably here in Israel, with a reduction in the relative proportion of deaths, with cancer now moving into the #1 position. But if we think about our mission of saving lives around the world, let us reflect on the fact that cardiovascular disease, including heart disease and stroke, account for an absolute number of 17 million deaths per year. And if we do nothing, this is expected to reach 23 million by the year 2030. So the American Heart Association has joined with a number of the sister associations here in support of the World Health Organization's global goal to reduce premature mortality from non-communicable diseases by 25% by 2025. Now, one of the things that we can think about is to switch our thinking from focusing on the treatment of disease to promoting a culture of health. Sharing information among our various societies is extremely important, and we learn from each other. We are all passionate supporters of this mission, and our governments need to work together to help save more lives. I would like to make a personal statement here, Yossi and Amit, that one of the proudest things I've been able to accomplish this year is to actually establish this joint session with the American Heart Association, which I hope will continue. The other thing that I'm especially proud of is to be able to travel in various venues with my close colleagues who are like-minded. Of course, my colleague from Brigham, Dr. O'Gara, our immediate past president of the ACC, now with Dr. Williams, and with Dr. Fausto Pinto from the ESC. This is the 90th year in existence for the American Heart Association, and we have a very strong track record of funding research. Some of you may not realize that the AHA actually has funded about $3.5 billion worth of research since 1949. That's second only to the National Institutes of Health. As you can see on this slide, there are a number of programs, and we create a global impact by our many educational programs and tools. We empower our population to save lives with our hands-only CPR program, which is very prominent in Latin America. Our pediatric resuscitation team has trained the trainer in Botswana and Tanzania, and most recently in Gujarat, India. And globally, we train 16 million people each year in first aid, CPR, and advanced life-saving. This also is complemented by our advocacy for stronger public health policies to support improved nutrition and the global coalitions that I've mentioned earlier. Our registry effort with Get With The Guidelines has expanded internationally as well. And we have over 6,000 AHA professional members outside the United States. We're supported with our 6 international sites here around the world, and this is how we have the 400,000 instructors around the world who are training people in CPR. Let me also mention that one of the things that we do is promote educational materials both professionally and for the public. I'm very proud to hold up for you this one-page document which explains in Hebrew the difference between a sudden cardiac arrest and a heart attack. all of us can recall those patients who mixed that up and didn't exactly know the difference between the two, so a single page. Very shortly, a Hebrew translation for the public of our Hebrew Friends and Family 17-page brochure will be made available in approximately 6 weeks. So I thank the Israeli Heart Society for helping verify the translation here, and Mogen David Adam for helping us with the Friends and Family program. And let me remind you that why are we here? We are all here because life is why. We want all of our patients around the world to enjoy those more important and precious moments which they hold so dear. And one of the strongest supporters of that concept is the Israel Heart Society, which not only promotes great research, but also has the passion for patient care. Thank you. It is a great honor to address you.